Hi to everyone. Greetings from India. Assalamu alaikum. Thank you, Dr. Ihab. I'm immensely obliged for having me here today. It is definitely a great opportunity, an honor and privilege to share this screen in this great scientific session on retinoblastoma. And hereby, I will be sharing my experience of intra-arterial chemotherapy. I have changed the title a little bit on and changed it to my Asian experience because my experience with intra-arterial chemotherapy is both in China and India. Once again, thank you very much. So treatment of retinoblastoma involves a bunch of team, and I'm extremely fortunate to have an excellent team with me, including my neurointerventional neuroradiologist who deals with intra-arterial chemotherapy and various other organizations. We are 100% clear as far as retinoblastoma, which is a childhood eye cancer. Saving life is the primary goal, and then comes to saving eyes and saving vision. And why is that very important as far as the topic, today's topic is concerned, is because we all know that intra-arterial chemotherapy is a targeted chemotherapeutic drug being introduced into the ophthalmic artery, and it doesn't actually help in salvaging the life. It was introduced in 2000 thanks to Professor Kaneko from Japan, and further it was popularized to Dr. Abramson, that further it has spread worldwide and considered as a primary management modalities in treatment of retinoblastoma. My journey with intra-arterial chemotherapy started when my fellowship, during my fellowship with Dr. Carol Shields at Wills Eye Hospital. Extremely grateful for her for teaching me everything about intra-arterial chemotherapy, and this paper was the outcome of that journey. From then, I started intra-arterial chemotherapy in my practice when I came back. And the most important thing about intra-arterial chemotherapy is that there is a direct introduction of chemotherapeutic drugs into through the via the ophthalmic artery into the tumor. So the effectiveness of the treatment on the tumor is much more pronounced. There is less systemic toxicity because this is again a targeted chemotherapeutic modality, and the various drugs used are, whether it's single drug, double drug, or triple drug, is melphalantopotecan and carboplatin. So again, intra-arterial chemotherapy has shown remarkable outcome as far as eye salvage is concerned, and to a certain extent vision salvage, but there is definitely a downside to it, and I have to be very open and honest about it, especially when compared to the country and the region that I come from and where I have my experience. Is you tend to have more advanced disease, delayed diagnosis, so when life salvage itself is a struggle, so the applicability of intra-arterial chemotherapy becomes a challenge. Now comes the affordability. It is an expensive treatment when compared to systemic chemotherapy, where most of the patients coming from a low socioeconomic strata, especially in the developing countries, the low income and the middle income countries, is unable to afford it, and the availability of expertise because there is a high learning curve. This was a review that we published on intra-arterial chemotherapy, where we have actually found excellent results in group D eyes, intraocular disease with intra-arterial chemotherapy. So when, as far as indications are concerned in my practice, I'm extremely strict about choosing the patients, and most importantly is when not to do intra-arterial chemotherapy, especially in an advanced intraocular RP setting where there is a high risk, clinical high risk for systemic micrometastasis. In case of bilateral retinoblastoma, bilateral intraarterial chemotherapy, where one of the eye is a potential good vision eye with a good vision salvage, I definitely don't want to take the risk of vision threatening complications of intraarterial chemotherapy. I would definitely avoid it. Whenever there is a radiological evidence or even a subtle evidence of extraocular extension and those tumors which is treatable with cryolaser and intravitreal chemotherapy, definitely intraarterial chemotherapy is a no. Coming to India, Well, making intra-arterial chemotherapy accessible, available, and affordable is a major challenge. Out of the many centers which deals with retinoblastoma treatment, we have 11 intra-arterial chemotherapy centers for the whole of the India. And in a private setup, it's definitely more expensive. So out of the 11, we have only 2 public system where intra-arterial chemotherapy is offered. So in this journey where I was struggling to find affordable intra-arterial chemotherapy system for my patients who come from a low socioeconomic strata, I was able to establish it in a public health system where they have modern and advanced equipments taking care of it. So here I'm going to share my data from China in 271 eyes where I have collated. And the outcome as far as eye salvage is concerned with intra-arterial chemotherapy in group D eyes was remarkable when compared to systemic chemotherapy, which was 47% and 85% in this group D eyes in our series, almost comparable to 94% with the Shield series. So these are a few of the results where you can see a group C tumor with 3 sessions of intra-arterial chemotherapy with complete regression, group D eyes with 4 sessions of intra-arterial chemotherapy with complete regression, a peripheral tumor with 3 sessions of intra-arterial chemotherapy with a very healthy posterior pole, which is correlated with the OCT over here. Group E eyes, do I do intra-arterial chemotherapy in group E eyes? Rarely, but yes, when the patients are when the parents are keen, after explaining the risks involved. And then this is one of those cases where, again, after completion of intra-arterial chemotherapy, the seeds have been treated with intravitreal. So the addition of the newer treatment strategies like intravitreal chemotherapy, we are able to salvage more eyes, be it intra-arterial chemotherapy or systemic chemotherapy. When it's a case of recurrence, with fewer sessions of intra-arterial chemotherapy with less systemic side effects, we can treat these patients when compared with systemic chemotherapy. Now, what is the safety profile is something that everyone asks. I have done systemic chemotherapy, was 4 weeks of age where the tumor was diagnosed intrauterine. This is published and this is the older patient, 15 years of age. We should be, aware of the vision-threatening complications, and this really helps us to choose the case, as I mentioned earlier. This is, focal alopecia after intra-arterial chemotherapy. Now, this is a case of a peripheral tumor treated with intra-arterial chemotherapy where there is complete chorioretinal atrophy with vascular occlusion. When you retrospectively think this would have been an eye with excellent visual prognosis. So I would conclude with this slide over here from our review where the SWOT analysis, the strength, weakness, opportunity, and threats of intra-arterial chemotherapy has been discussed. So strength definitely is it's a localized treatment, less systemic toxicity, reduced treatment duration when compared to systemic chemotherapy, and less rate of new tumor development. Well, weaknesses, we all know that it lacks systemic chemoprotective effects. So in advanced disease, it's definitely a no. Irreversible vision-threatening complications, as I showed, it is expensive, and hopefully in future, I hope this treatment modality becomes more affordable to a larger population in the world. Thank you so much for your patient listening, and I'm extremely honored to be here today. Thank you.